However, we have a vaccine for it. Once you get a vaccine, the probability for you getting cervical cancer at a young age, it has been lowered. So it means even if you are going to get cervical cancer, you'll get at a very old age, at the age of your late 50 and 60, 70. Unfortunately, nearly half of our patients, they are less than 40 years old.
Oh my.
Less than 40 years old, you can imagine. So it means we are losing our generation to cervical cancer. Why the incidence is very high? Perhaps is more of our sexual behavior.
Pearl Radio, the home of fresh and classic hits.
And today, I'm joined in studio by an amazing gentleman, and we're going to be talking about an interesting conversation right here. We had the World Cancer Day. Is it yesterday?
Yes.
It's the 4th of February.
Yes, we had the World Cancer Day yesterday, which is commemorating the whole world.
Yes.
On 4th of February, 2025.
Absolutely. And Dr. Abeid, I don't want to massacre your name. Dr. Abeid Athman. I got it right.
Yes, you got it right.
Thank you. He's the head of oncology department at the Kenyatta University Teaching, Referral and Research Hospital. Right here, we're talking about the World Cancer Day and the issues around that. And mtu akisikia cancer, it's like it's a death penalty. Is it true? Just hiyo tu ya kwanza kabla tuingie ndani.
The answer is no. It's not true.
It's not true.
No, it's not true.
So there's hope.
A lot of hope.
All right. Okay, there's hope there because we've had so many people talking about cancer. Ikisikika tu cancer ndio hiyo amepatikana nayo, they give up. What is it usually the challenge of with the person ama the disease? Because ukisikia hivyo, the people who say if you have a strong willpower, it's very possible for you to overcome.
Thank you so much for having me this morning here. First and foremost, what I would like to start the conversation with is like there's this wrong perception in the community,
yes,
which is not only in Kenya, it's all over the world, but here is worse in Africa. The incidence of cancers are now becoming common, so more people are being diagnosed with cancer. It is not like this diagnosis was not there before, it was there. However, some were dying without knowing why they were dying. For example, you hear like my grandmother, my grandfather was complaining a lot of back pain and everything, was not able to walk. At the end of the day, she died or he died on the bed. All these could be cancers because we know some disease like prostate cancer, the only sign it shows up is only like when you cannot walk, you have pain in your spine and everything. So it could be possible. Now we are increasing like a diagnosis, we are seeing more numbers. So more people are now hearing about cancer. Then the last 5 years, we have had very prominent people like being diagnosed with cancers, coming out clearly and openly in medias. This has really helped in creating awareness of the cancer.
Yes.
I think now more people are coming for screening, especially the young generation. The young generation, I mean like those who are 40 and below, compared to the older one who are 65 and above. Actually, we even have these old people who are also coming for the screening and everything.
Yeah.
But the number who coming at a younger age are much more. Going back to your question, talking about cancer being a death sentence, there's a philosophy we say early detection saves lives. This is very true. If you go to America and you go to Europe, usually the cancer is being like the survival is being given like 5-year survival.
Yeah.
So when you talk about 5-year survival, because at that time people used to die with a lot of cancer, so 5-year survival was put like the least we expect a person can live having with cancer. But the reality, this was in early 60s and 70s in the US and the Europe. In Europe right now and America, we have people who have been living with cancer for more than 20-30 years. Even here in Kenya, I know several cancer survivors who have been living with cancer for more than 10-20 years. So there is hope, not only in Europe, here in Africa, we have the same.
Okay.
So what's the difference? The difference is early detection.
Early detection.
Yes. If cancer is diagnosed very early at stage 1, maximum stage 2, you can be cured and you go back to your normal life like any other person who never had cancer. So the person who had cancer and you'll have no difference. The challenges come in when the cancer is diagnosed late. Then this is what people have been seeing around. So it has created a notion like cancer is a death sentence. Because by the time they come to the hospital, we have little or no option to help these kind of people.
Right. That's really encouraging right there. And before we go to the most common cancers that are there, there are cancers that I've been trying to do my own research. There are others that cannot be identified early enough, that by the time you're realizing unapata hii cancer, it has really exceeded equals stage 3, stage 4. Is it true?
Unfortunately, all cancers, they are painless. They come without pain.
Yeah.
You might notice some body changes. For example, you keep on complaining of acidity. You keep on complaining about abdominal pain. For the women, they maybe they complain like this: my period or my menses has lasted longer. I'm having sexual intercourse with my husband, it's painful, or with my partner, it's painful. Excuse me. Those are like the body is trying to inform you there's something wrong happening to your body, but we keep on ignoring these signals. Like the famous saying, they say like we are used to red color being your favorite color, so now red it's not a red flag. So those are the small red flags which people keep ignoring them.
Yes.
Yeah, so we need to pay attention to these small red flags the body is giving us. Unfortunately, most of us, we have this kind of symptoms, we go to the pharmacy and we buy over the counter medication for pain management and everything. So I think this has created for us a very big problem. However, I cannot blame the community, because most people, they don't have insurance which can take care of them, like somebody to go for annual screening for the whole body health checkup and everything. Because of this, most people, they cannot afford this. They have to go just over the counter. They cannot even go to our public hospital because they feel like this is something can be managed at home. So by the time somebody is developing symptoms, for example, for the gastric and esophageal cancer, this person cannot feed. This is the time they're coming to the hospital. Most of the time it's already late. It's like stage 3 or even 4. So this is the things we want to create awareness. We want changes in our community. Any small thing you feel it's abnormal, please just go to the hospital, let you be checked. If you are treated for, let's say, gastritis, acidity and everything, you are treated the first time, you are treated the second time. The third time you need to tell the doctor, no, there's something wrong with me. You have treated me first time, the second time, this thing is not improving, or is coming back. Can we think beyond what we are seeing here? Can we do some invasive diagnosis? For example, if you are having those acidity which are coming back on and forth, you're having constipation on and forth, go ahead, let's do let's say endoscopy, or we do something we put a camera over your mouth, it goes all the way to your stomach to see what is happening. The same, you're having constipation on and off, we just put over there another camera going through the way you pass your stool, and we check if there's everything is okay. For the women, it's just you put a speculum examination. These are very cheap. The good thing about cancer, when you get it very early, management is extremely cheap. Most of them, they might need just surgery and forget about it. But when you come stage 3, stage 4, the whole process is extremely expensive and extremely tedious. So that's where you hear a lot of families, they have to sell their kidney, they have to sell their houses, their chambers and everything, because it is late, it is very expensive. So what we are pushing our people is early detection. Go for cancer screening. Don't ignore those small red flags.
So early detection is the key. Now let's talk about the World Cancer Day. What is the theme for this year?
So usually the World Cancer Day is being led by the International Union of the Cancer Control, which is UICC, is a branch of WHO. So they are the one who determines the theme. So usually the theme runs for 3 to 4 years. So the last theme, which ended last year, it used to be closing the care gap in cancer care. So now this year they say united by unique. What does it mean by united by unique? United by unique, it means each patient is unique in her cancer or his cancer journey. So that journey is very unique. From the time of diagnosis, the time of treatment, the time of follow-up after cancer, what we call survivorship. Remember, cancer does not only affect the patient, it also affects the family. So that uniqueness, we need to bring and recognize it. Because one person may come from a rich family, another person may come from a poor family. Each one is unique, but this uniqueness should not lead us like some people to be treated better than others. We need to come together and we take care of everyone in their unique way in the managing of cancer control.
All right.
Yeah.
Very, very important right there. Now, what are the most common cancers at the moment?
Okay. Thank you. This is a very interesting question because it's very important for our listeners to understand what we are diagnosing very common in our country. 2-3 years ago, the most common cancer used to be cervical cancer. However, now we have gone back, like what reflects in the West. Now breast cancer is the most commonly diagnosed cancer in Kenya. It's the leading cancer actually. Number 2, cervical cancer. What you notice, all these cancers are occurring in women. Number 3 is prostate cancer. Number 4 is esophageal cancer. Number 5, we go to colorectal cancer.
Esophageal is the
cancer of the throat.
Okay.
The cancer of the throat, feeding throat, where your food passes through. Esophageal cancer. So I can say these are the top 5 cancers. But if you realize, despite all these like being top 5, women, they're having top 2 in the world. And in Kenya, top 2, that is breast cancer and cervical cancer. While men, they are leading in prostate cancer, but overall it is number 3. So the most common diagnosed cancer in men is prostate cancer. Then after that, we have esophageal cancer being more common in men compared to women. Then we have colorectal cancer. Now there's almost a balance between female and male. So overall, breast cancer, cervical cancer, esophageal cancer, prostate cancer, these are the most common. But the good thing, especially when it comes to cervical cancer, this is a preventable cancer. At this age in time, there's no reason any woman, to be diagnosed with cervical cancer. If we looked at the dynamics of cervical cancer in Europe and America, it is diagnosed at the age of 65 and above. So usually cervical cancer, like histologically how we see under the microscope, it is like divided into 2. You know, like our body is made of tissue. So this tissue is in layers. So the upper layers is like, because it's just in the womb of the woman, we call it adeno, because there are some glands which they help you like to go your period and everything. The lower part of the layer, we call it like a squamous layer. So the upper layer, we call it adenocarcinoma. Carcinoma means cancer. The lower part, we call it squamous carcinoma. So the most common cancer occurring in women above 60 years and old is adeno, and this is the most common in Europe. So cervical cancer is supposed to be diagnosed in very old. Here in Kenya, we are seeing a lot of squamous cell. It means we are getting the lower part. Why the lower part? Because the lower part is where the virus is coming in. So the most common cause of cervical cancer is human papilloma virus, which is famously known as HPV. So this HPV, like me and you and all women, they will have it. The good thing, most of us, we are able to clear this virus. Because we're able to clear a virus, we are not getting the infection. We are not getting cancer, because after it stays long for very long, we are not able to eliminate it. Then it converts it to cancer. However, we have a vaccine for it. Once you get a vaccine, the probability for you getting cervical cancer at a young age, it has been lowered. So it means even if you are going to get cervical cancer, you'll get at very old age, at the age of your late 50 and 60, 70. Unfortunately, nearly half of our patients, they are less than 40 years old. Less than 40 years old, you can imagine. So it means we are losing our generation to cervical cancer. Why the incidence is very high? Perhaps is more of our sexual behavior, because out of these women coming with squamous cell carcinoma, up to 80% are HIV positive.
So that's probably the reason.
Yes, because you remember HIV/AIDS by definition is immunodeficiency. It means your immunity is low. that means your body cannot be able to eliminate human papilloma virus.
Yeah.
So it converts. So once it converts, now you cannot eliminate it, becomes cancerous. So if we could improve our sexual behavior by avoiding getting HIV.
Yeah.
Number two, you stick to one or your partner. The chances of you taking different human papilloma virus strains from one person to another, because your body is used to only one strain.
Yeah.
Remember, we have very many strains of human papilloma virus. The famous one being 14, 16, and 18 causing cancer. So what I may have and what you may have could be very different. My body is used to number 14. When 16 comes to me, I cannot eliminate it. So because of this, we encourage everyone to get vaccine. The vaccine will protect you from all these strains. So what you're having, it is normal for you. Your body will fight it. When you contact from the other person, then it becomes like easy for the vaccine to help you in fighting. So it is very sad losing very young women to cervical cancer for something which can be prevented through sexual behavior and vaccine. So I think this is something I'm asking our listeners. They should take care of it. I know the government is offering vaccine to the young women 9 to 13 years old, but the reality, this vaccine can be given at any age to male and female. It prevents. Remember, human papilloma virus does not only cause cervical cancer.
Men can also be given
HPV vaccine. Remember, there's a lot of oral sex ongoing. So nowadays we are seeing increase in incidence of oral cancer, especially in men. Men.
Yes.
Remember, they are going down there. Because of oral sex. So they are taking that virus from down there to their throat. So they are getting oral cancers. So the human papilloma virus, it is helping the man and the woman.
Yes.
If the woman is vaccinated, the probability of spreading it might be low. But you as a man, even if when we are vaccinated again, the probability for you this virus convert into cancer becomes low. So you can through the HPV you can get the throat cancer. You can get penile cancer. Yes, cancer of the penis, cancer of the anus.
Yes,
cancer of the vagina, cancer of the vulva. All these are caused human papilloma virus. So all these are preventable. If we can go for vaccination, it's the best.
All right.
Let me go to the most common cancer, which is breast cancer. Again, we have very high incidence of young women being diagnosed with breast cancer, up to 30%, which is very high. So usually cancer, we say they're disease of the old age. So anything below 40 or 50 is considered very young. So usually, again, we have what we call screening. So screening can be done by mammogram, which can be started at the age of 40 with mammogram, but with family history of having cancers or other risk genes, like the famous BRCA gene. Like we have the famous person, Angelina Jolie. So Angelina Jolie, when she realized in her family there's BRCA mutation, like being carried in the family, she went for to remove all her breasts to prevent having breast cancer. But we are not asking our listeners to do that. If they can do, that is up to them. But at least the least they can do is to go for screening, because breast cancer is one of the most manageable cancer. If you can detect it very early, most of the survivors in the world, they're having breast cancer, they have been living for more than 30-40 years. So it is something we can do it. The main challenge now come to esophageal cancer, because by the time you realize, it is when you cannot feed, the feeding pipe has blocked. So when you're feeding, you notice you cannot take hard food, or so what we call solid food. You can only take blended food or liquid. By the time you come to us with this symptom, is extremely late. Until now, if there's a challenge, there are no screening method in esophageal cancer. What we encourage our people, this gastritis people have been calling my ulcers, or the so-called my acidity, if it persists for very long, please go for checkup. What can be done? We can do endoscopy. So if we can get these cancers very early, there's a lot of hope. So we can increase the prevalence of this cancer. I mean, like survivors. As we reduce the number of mortality, the death due to these cancers. And for men, I would like to encourage them to go for prostate cancer screening, because prostate cancer is the leading cancer in men. Unfortunately, men, we don't go for screening. So if we can take care for screening, again, we get it very early, we treat it if there's a need, and these men, they're going to live very long.
It is important. Remember, early screening is the key. And You've talked about the different types of cancers. Now, specifically at KUTRH, which cancers do you treat there?
So we treat all type of cancer types. As I mentioned, the national reflect what we have at KU referral. So our leading cancer is breast. We have cervix. We have prostate in men. We have breast, esophageal cancer, colorectal cancer. We have all this kind of cancer. Actually, because of the increase in the number of breast cancer at KUTRH, we have a dedicated unit just to take care of breast cancer. Yes. So we come there, we have what we call a comprehensive breast cancer care, because more than 20% of our cancer patients, they are breast cancer, so we take care full of them.
Okay.
We also have cervical cancer, we'll take care of them in full. All types of cancer, we are seeing them.
All right.
Yeah.
Now, because of time, we're going to be going a little bit faster because of time. Now, what are some of the methods of treatment that you engage or you use or have adopted at KU?
According to this year's theme, is united by unique. So each person is unique. In oncology, we have what we call personalized medicine. It means each person will be treated differently.
Yes.
Then number 2, we have what we call shared decision making. So when you come to us, we'll discuss with you, we'll lay down all the available options, then you decide.
Okay.
We guide you. So if you come very early, most of the time surgery. Yeah. So at KUTRH, we have all subspecialists. We have dedicated breast oncosurgeons. These are surgeons only operating on breast cancer.
Yes.
We have colorectal surgeons only operating on colorectal. We have cardiothoracic surgeons only operating esophageal and some gastric cancers.
Yes.
We have urologists who are only operating on the prostate cancer. So we are a highly specialized hospital dedicated. So when you go there, it's not I'm not undermining other hospitals, you'll be put under one specialist who has gone to school to focus only on that one disease. It's not like being operated by a general surgeon. A general surgeon is the person who can treat everything. So even after that, the general surgeon, we call oncosurgeon or surgical oncologist. So for us in KUTRH, we have gone beyond that. We have dedicated surgeon for each kind of specialty. As the cancer progresses, the treatment also changes. Instead of going for surgery, now you might need chemotherapy first. Chemotherapy is a kind of disease where you treat the disease to control it. Maybe it has gone to other parts of the body which we cannot see.
Yeah.
After that, if possible, you can go to surgery. So surgery after chemotherapy. Then after that, you can go to radiotherapy. The good thing about KUTRH, we have what we call CyberKnife. CyberKnife is a robotic, advanced precision type of radiotherapy.
Wow.
Where it can treat even small types of cancers in your brain, in the lungs, in the liver, in the spine, where a surgeon cannot operate.
Okay.
So where the surgeon cannot operate, we have CyberKnife can take care of that. And the advantage is the high precision. We can treat with a precision of 1 millimeter without going to the normal tissue. We just focus on the cancer. The other advantage, instead of you being treated for 30 sessions, we'll just treat you with 5 sessions. So we make the experience better for you. You have more time with your family to focus with your work, not to focus for you coming to hospital on and off.
Right.
However, this is not done to all cancer types, just to selected cancer area.
Okay.
Yes. Then after that, we also have other hormonal treatment. We have targeted therapy. We have immunotherapy. So nowadays, there's no reason why people should go abroad to seek for cancer care. Everything is available in Kenya, particularly KUTRH.
All right. That is so encouraging that we can get the services here, because healthcare has become quite an expensive affair.
Definitely.
There's somebody who said that most of us are a sickness away from poverty.
Totally agree with that.
So if you're healthy and you're okay, thank the Lord and always give thanks. Now, as you slowly wind up, we talked about why is it that more men they're in this situation, cancers, if they're prostate cancer, they don't even need to go, they don't go for checkup or something like that tunashikilia mwanaume ni kujikaza. Why is it so?
I think men are natural providers. Even if you have your wife or your partner who is working, men are the natural providers. So being providers, it gives them the responsibilities if they'll be in hospital on and off, it means some is going to miss the job, maybe may end up being unemployed. I think this is an area where the government need to look at, like being in like on active treatment. We need to support these people, not to fire them from work, so they can take care for their families. So if they can take care for their family, I don't think any man will stop coming to the hospital. Considering you're the provider, not able to work, thinking like your family is going to suffer because of the disease, most men will choose to die. Like you fight until the end, you are going to work. Only when you cannot go to work, that's when you come to the hospital. I think it's a bad culture. We need to change it, but this will be possible through the cancer advocacy and the government. If we can change the policies and laws in this country, then I think most men will be able to come to the hospital. As it is, men are providers. We don't want to stay out of work.
All right. Finally, that's because you said very few men came for the screening that is happening
at KUTLH. So right now, we in the commemoration of the World Cancer Day at KUTLH, we have been having free cancer screening. We are screening for the most commonly diagnosed cancers, which is breast cancer, cervical cancer, and prostate cancer. They are absolutely free. The only thing which might be needed will be paid by SHA. So far, so good. Despite all the challenges with SHA and what we are hearing, at KUTLH it has not been very disappointing compared to other places. The reimbursement, they are going on well. A few technical hitches which can happen like any other system, but it is working at our institution. Other institutions may be having challenges, I don't know, maybe being a government, but it is working. So we encourage everyone to come. If what cannot be covered free of charge will be covered by SHA.
All right. So it's an opportunity for you to head on to KUTLH. I think it's on Thika Road.
Yeah, we are at Kahawa West. Yes, we are along the Northern Bypass. Yes, and today is the last day for free cancer screening.
Is the last day. So you better get there. You never know, so that when you're praying, you know exactly what you're praying for. Say, God heal me, God heal. But what exactly are you praying for the Lord to heal? Now, finally, what other services do you offer there?
Thank you so much. So, KUTLH is one of the government flagship for cancer management. So usually cancer starts with diagnosis. So we have a very comprehensive diagnostic services at KUTLH. Number one, we have the mammograms, which is very important for the breast cancer. We have very advanced machines for CT scans, for staging. We have MRI machine looking at cancers in the brain, in the pelvis. And the most important, we have like molecular imaging, which is famously known as PET scan. Before, initially, people used to go to India to seek PET scan services. We are the only public hospital in the whole country and in the East Africa. So we have patients coming from all over East Africa coming for the PET scan. So these services are available. No one needs to travel abroad for this diagnosis. Besides this, we also have like counseling services. We have palliative care services. So we take care of for our cancer patients from the beginning of the journey until the end of the journey. We don't leave you alone. When it comes to feeding, because most of these patients, they'll need cancer support and nutrition, we are doing all the like nutritional support. Sometimes our head and neck cancer, they need dental care and everything. So we have dental care both for cancer patient and non-cancer patient. We take care of mental health. Remember, KUTLH is a teaching, research and referral hospital. So we also have teaching for the nurses. We have oncology nursing. We also have, like we are collaborating with different universities where they have their students to come to do some specialization, their master's program. So it is not only a teaching as is like a treating hospital. We are also doing research, and we are also doing a lot of teaching. And remember, when you come for our services, you don't need to worry like where you are going to stay. Inside KUTLH, we have accommodation, and these accommodation, they are very competitive at an affordable price compared to what you can get outside there. So you'll be within the compound of the hospital. You'll be accommodated. So you'll just walk from your room, the treatment, and back to the room until when the treatment is done, and you go back, and it's very affordable.
96.9 FM, Pearl Radio.